Welcome to Ocean County Veterinary Hospital. I'm Dr. Erica I. Quinto, and today we're going to be showing you what goes on behind the scenes when your pet comes in for a dental procedure. So this is our patient Archie. He's a 7-year-old little Yorkie mix, and he's in good health, no prior medical conditions. Archie does have a good amount of dental tartar and gingivitis, and that's what we're going to be attending to today. Okay, so the first step was the physical exam, which was normal. So step 2 is doing preoperative blood work, and that's checking to make sure liver and kidney function is normal for anesthesia, and that his red cell count and platelet count and white cell count are okay for the dental procedure. So now that we know his blood work is okay for the procedure, Archie's going to receive his medications. It's a sedative, so that helps relieve some anxiety and makes him go more smoothly under anesthesia. And it also has some pain medication in it to provide him any kind of pain relief that he may need. We're going to proceed with the anesthesia. We're going to give him his induction medication to get him under general anesthesia, which is quick acting. And then we're going to put in an endotracheal tube into his airway, and that gives a controlled and protected airway. So that way the anesthetic is going directly to his lungs and coming back up into our system, and that keeps us protected, and it keeps him in a great plane of anesthesia. And it also has a cuff at the end here, which is a protective mechanism. So we inflate this, and this keeps any fluid or debris from going down into his airway. Now that he's nice and sedated, we're passing the endotracheal tube, and we're going to connect it to our anesthesia machine. We lubricate their eyes just because we don't want them to dry out. That can cause some corneal scratches or abrasions there. Archie's now hooked up to an EKG monitor, so that gives us a constant heart rate and heart rhythm. He's also on a heat blanket, and that helps maintain his body temperature, especially these smaller dogs. Their body temperature tends to drop, and that makes them hypothermic and could interfere with our anesthesia and recovery. So he's got a water warmer, a blanket, and he's on a cushioned mat for support. Every dental procedure here at Ocean County Veterinary Hospital includes full mouth dental x-rays. Our machine is digital. We take an x-ray of the entire mouth so we can see if there's any underlying disease below the gum. Here are Archie's completed mouth x-rays, full mouth. So this is his upper jaw, this is his lower jaw, and this is the right side, and this is the left side. So we're just looking to make sure he's got adequate bone coverage, that there doesn't seem to be any evidence of infection or abscesses in these teeth, and to make sure that he has all his teeth. After the dental x-rays are performed, the mouth is charted and probed to see if there are any abnormalities we need to address. So you can see that Archie has a moderate amount of plaque and tartar on his teeth and some mild gingivitis. This would be graded 2 for periodontal disease. So we're just going to check his pockets here to see if there's any excessive recession of his bone. Check for any evidence of infection. So now we're going to go ahead and do the scaling. So this is our ultrasonic scaler, and it uses water to flush away all this heavy tartar. And you'll see Cassandra cleans the surface of the tooth, all sides, and also goes underneath the gum line to take care of all that bacteria that's setting shop under there. So as you can see, it's very, very important that this animal is under general anesthesia in order to do our job effectively to clean that mouth, and for the safety of the pet and for the safety of our staff. Once the scaling is done, the next step is to do polishing of the teeth. The previous scaling, although very, very beneficial because it removes the tartar and bacteria load, it does cause little micro scratches on the tooth surface. So by polishing these teeth, we provide a nice, smooth, slick surface to those teeth, and hopefully that keeps plaque from adhering to that tooth. So the purpose of trying to do preventative health care here with this dog's mouth by doing the cleaning before there's a problem is that there's so much bacteria on these teeth and under the gum line, and that can lead to serious heart and kidney infections. So by flushing it away and removing that debris, then hopefully, 1, that we keep these teeth healthy and in this animal's mouth longer, and 2, that we keep his body healthy as long as we possibly can. Okay, this is our patient Archie. He's about an hour after his anesthesia, and you can see he woke up very well and he's feeling good. So we just want to go over all the paperwork that includes in his records now. So his emergency drug papers, his anesthesia monitoring. So during the time of the dental, every 5 minutes we were writing down all his vitals, including his heart rate, his blood pressures, his oxygen saturation, and so forth. His dental chart, his pre-anesthetic blood work, and then also his x-rays, which will go home with his owner, and a copy of his pre and post pictures. Archie also goes home with printed out discharge instructions to give the owners information about what to expect post-op, and so forth. And so we would probably recheck Archie in about 10 to 14 days and make sure he's healed properly. It's very important to keep the teeth as healthy as we possibly can and to remove that bacteria load in his mouth. It's not just for dogs. Both cats, rabbits, some other small mammals do require dental care. So if you have any additional questions, please contact one of our doctors here at Ocean County Veterinary Hospital. We'll all be very happy to talk to you about it.